Good morning or good afternoon, good evening, wherever you are in the country and the world. Really delighted to get some time with you all today. Thanks for joining us. My name is Mason Davis. I use he, him pronouns, and I am the Executive Director of Funders Concerned About AIDS, and just delighted to welcome you to this briefing today, this deep dive, HIV-related philanthropy and the Ending the HIV Epidemic in the US initiative. For those of you who might be new to FCAA, we are a philanthropy serving organization, or a philanthropy mobilizing organization, as I like to think about it, with the mission to inform, connect, and support philanthropy to mobilize resources to end the global HIV pandemic and build the social, political, and economic commitments we need to attain health, human rights, and justice for all. Today's webinar is a great example of why philanthropy is critical to ending the HIV pandemic. Not to share a big spoiler alert, but if you've seen our infographic and information before joining today, you already know there's not enough funding going to the communities that need it the most around the world. And particularly today, we're going to talk about the US. The recent announcement by the state of Tennessee to reject HIV funding from the CDC has made this work even more urgent at this time. It's one of the reasons I'm so grateful that you all are here today. Your participation is so critical. You know, we have the data. We understand the gaps between needs and resources, and we clearly see the opportunity to align more funding with the federal EHE initiative in the US. So today in conversation with you all, we hope to unlock how to best use these tools to truly change funder attention and behaviors around HIV grant making in these high need jurisdictions. So before I jump in today, I have a few logistics I want to cover. First, this is a meeting format. We actually want to encourage engagement and discussion, especially at the end of the session today. So I want to encourage anybody, if you're able and comfortable, to turn on your cameras. We'd love to see you. Throughout, you can also use the chat function and Q&A functions as shown on the screen to share comments, reactions, and questions. And if you're struggling to use that, you can email them to Sarah, S-A-R-A-H, at fcaaids.org. The session is going to be recorded, but it's not going to be made public. This is a funder-only conversation, so it will not be made widely available. We may share it, though, with members and use it for some of our own planning. Finally, as you all know, it's a non-solicitation space. We believe information is critical and critical to advocacy, and we want to make sure that we have platforms that bring together stakeholders, activists, and funders. But we also want to make sure we have a space for grant makers to network and learn from each other. And that means having it be free of solicitation. So please don't ask people for money, but do engage in these issues, get to know each other. There's great people on this panel and throughout the meeting. So glad you're here. If you have questions, don't hesitate to reach out to the hosts via chat. You can also comment to Sarah on our team who's monitoring the chat as well. So now on to the agenda and the good stuff. First, we can't have this conversation without the Office of National AIDS Policy, and we're fortunate today to have taped remarks from Harold Phillips. He wasn't able to join us, but he will be with us in DC next month for our advocacy forum. So please register for that. It's in DC on April 19th. It's going to be great. After that video, you will hear from our own Kat Gironda and Deasia Lee from Treatment Action Group that will walk us through recent data on the philanthropic and federal funding responses. Then Amelia Karagi from ViiV Healthcare and one of my favorite FCAA board members, though they're all my favorites, will moderate a funder conversation with Athena Cross from AIDS United and Sarah Hashmal from the Morris and Gwendolyn K. Fritz Foundation, followed by an open discussion with the full audience. So with that, I'm going to turn it over to Harold to get us started.
Hey, Kat, I just want to stop and say you might need to share your screen with sound because it's not coming through.
We hear nothing, yes. Sorry about this.
Oh, I'm sorry. Okay. Sound was on for me. Okay, let me try again. Apologies, technological issues. Okay.
I find it never matters how many times you test something, there's always a snafu in the moment.
Of course. All right, let's try this. No. Not working again. Okay. That is unfortunate. I wonder if
Give me one second, I'm working on it.
okay.
Thank you for dealing with our technical difficulties. If not, Kat, we'll move on to your presentation, but let's give it a minute, see if we can get this video working.
Okay. I'm going to try
with you this morning.
We have sound.
HIV has cost America too much for too long and remains a significant public health issue. More than 700,000 American lives have been lost to HIV since 1981. More than 1.1 million Americans are currently living with HIV, and many more are at risk of HIV infection. While new HIV diagnoses have declined significantly since their peak, progress on further reducing them has stalled, with an estimated 38,000 Americans being newly diagnosed each year. Without intervention, nearly 400,000 more Americans will be newly diagnosed over 10 years, despite the availability of tools to prevent HIV transmissions. The US government spends about $20 billion annually in direct HIV health expenditures for both prevention and care. And there is a real risk of an HIV resurgence due to several factors, including trends in injection and other drug use, HIV-related stigma, homophobia and transphobia, lack of access to HIV prevention, testing and treatment, and a lack of awareness that HIV remains a significant public health threat. The Ending the HIV Epidemic in the US plan is a bold plan announced in 2019 that aims to end the HIV epidemic in the United States by the year 2030. Agencies across the US Department of Health and Human Services developed operational plans to pursue this goal, accompanied by additional requests for annual funding. The plan leverages critical scientific advances in HIV prevention, diagnosis, treatment, and outbreak response by coordinating the highly successful programs, resources, and infrastructure of many HHS agencies and offices. Initially, the initiative focused on areas where HIV transmission occurs most frequently, providing 57 geographic focus areas with an additional infusion of resources, expertise, technology to develop and implement locally tailored EHE plans. The local plans are developed and implemented with significant community involvement and focus on 4 pillars. The first, diagnose all people with HIV as early as possible. The second, treat people with HIV rapidly and effectively to reach sustained viral suppression. The third, prevent new HIV transmissions by using proven interventions, including pre-exposure prophylaxis, known as PrEP, and post-exposure prophylaxis, such as PEP, and syringe services programs and harm reduction. The fourth pillar, respond quickly to potential HIV outbreaks to get prevention and treatment services to people who need them most. Ending the HIV epidemic requires a whole of society approach, and this is why in December of 2021, President Biden released a new national HIV/AIDS strategy, which outlines the steps that can be taken to increase coordination across all sectors of society for better delivery of services and resources to people with or who experience a risk for HIV. Increased coordination at the federal level includes expanding the partners engaged in our national HIV response. This includes our philanthropic sector partners. And the federal government is investing more funding than ever before as part of this national response. Our programs are showing with an increase in resources, they can reach and engage more people. This is taking place in the midst of the COVID-19 pandemic of the past 3 years and the mpox outbreak of last year. Our HIV prevention and care providers need additional funding and support from the philanthropic sector. This is especially true as many state and local governments attempt to continue politicizing public health and include ending the HIV epidemic in such debates. At the federal level, we will continue to find ways to do our part to remain mission-driven and steadfast in our work during these troubling times. When we have the tools to end the HIV epidemic, but lack the resources and political will in some communities. This is why we need greater collaboration and coordination with our philanthropic partners to help ensure that resources are allocated according to current burden of disease and that the most effective prevention and care strategies are tailored to local community needs and populations to achieve maximal results. Funders concerned about AIDS, your work to analyze HIV-related philanthropy and connect funders to help mobilize communities is needed more now than ever. Your call to action to help attain health, human rights, and justice for all aligns with the vision articulated in the National HIV/AIDS Strategy. The United States will be a place where new HIV infections are prevented. Every person knows their status, and every person with HIV has high-quality care and treatment and lives free from stigma and discrimination and can achieve their full potential for health and well-being across the lifespan. This vision includes all people, regardless of age, sex, gender identity, sexual orientation, race, ethnicity, religion, disability, geographic location, or socioeconomic circumstance. I'm proud and excited to have you as partners in this work, as together we make this vision a reality. Thank you.
I can't imagine a better framing and inspiration to get us started today. And with that, I will turn it over to Kat Dronda, our Research and Program Manager at FCAA.
Hi, everyone. Apologies for the technological challenges. Can you see my slides up on the screen now? Okay, wonderful.
Yeah.
Thank you, Sarah, for jumping in on that. And thank you, Mason. And I'm really glad as well that we had Harold to kind of help us step back a little bit and really ground us in this conversation and think about what's happening in the United States, how the federal government is responding, and really why we are having this conversation to bring philanthropy to the table and think about all the efforts that are happening to partner on the EHE effort. So FCAA wants to bring a little more data to the table before we dive into the conversation. So that's what I'm going to do right now. As many of you know, FCAA tracks philanthropic funding for HIV epidemic globally. And in the US, we track down to the state level typically, but we wanted to be able to understand how HIV-related philanthropy was reaching the 57 EHE jurisdictions. So we bolstered our data a bit to be able to track funding reaching organizations that were based in those 57 jurisdictions. And that's what I'm going to tell you a little bit, walk you through a little bit today. So we released an infographic in the fall of last year, at the end of last year, and we're going to drop that in the chat so you'll have access to this. And I'm just going to go over some of the top line content and not sort of deep dive too much, but essentially what we're looking at is HIV-related philanthropy distributed to organizations based in those jurisdictions. And we're looking at 2020 data because that's our most recent, and we're working on 2021 data. We'll update this as we proceed. But we saw about $60 million in HIV-related philanthropy reaching organizations based in those jurisdictions in 2020. That's about 20% of all HIV-related philanthropy to the United States. And to clarify further, we removed funding to organizations that were based in those jurisdictions, but were only doing work at the national or the regional level, right? So we really wanted to understand how much funding is going to those jurisdictions and staying in those jurisdictions for local work. So we tracked about 1,300 grants coming from 130 grant makers to about just under 600 grantee organizations. And again, I'm just going to kind of highlight some of the key takeaways there, but one of the things that really resonated was that the vast majority of that funding was reaching the top 10 jurisdictions. And you can see from this donut chart here, right, 75% of funding almost going to those top 10. And predominantly you're seeing the big cities, right? San Francisco, New York, DC, LA, Chicago, and so forth. But the remaining 47 jurisdictions received just 2% or less of that philanthropic funding. So as always, we find it important to understand where the funding is going, but equally as important is understanding where the funding is not reaching, right? And highlighting those gaps. And I think that's a really valuable tool for funders to understand as well. And in the rest of the infographic, you'll see, that we highlight how this funding breaks down by population, by intended use and strategy. And so I encourage you to sort of dive into that. But when you want to think about looking at an individual jurisdiction and how that funding breaks down there, we have another tool available. And this is a really exciting partnership that we've been doing with AIDSVu. AIDSVu, for those of you who don't know, is an online interactive mapping tool powered out of Emory University. They do phenomenal work and have great resources mapping the HIV epidemic in the US. And with this new partnership, you'll see on their site, they have local profiles for each of the 57 jurisdictions, which is something they added recently with the EHE epidemic. So you can look at those county level data now, and you can see there's a sort of sample on the right hand side of Shelby County, but you can see how the funding is mapping out. You can see how the epidemic is mapping out in a single jurisdiction on their website, right? So you can see HIV prevalence, new diagnoses. You can see demographic data, transmission types, really, really valuable content. And then part of this partnership is that they've now included FCAA's data on philanthropic funding to the jurisdiction as well on that same profile. So I'm going to attempt another technological challenge and see if I can do a quick demo just to show you how this looks. Has my screen? Awesome, fabulous. So if you go to the site, and we'll drop these links in the chat so you can access it, on this local data tab here, you can see you have national, regional, state, and county level content. And if you zoom down to the county level, you've got, this is where the majority of your jurisdictions are going to be found. Obviously, the states will be here and San Juan will be in the cities. And I'll zoom in on Shelby County as an example. As Mason mentioned, we understand what's happening. I'm sure most of you know what's happening in Shelby County, where the state government has rejected the federal HIV prevention funds from the CDC. And so it's an interesting example for thinking about how philanthropy can not only show up to support and bolster the federal funding that's already there, but to step in scenarios where federal funding is lacking, right? For advocacy work or whatever, like thinking creatively about what philanthropy can do to support in scenarios like this, where we know that organizations and communities are going to be hard hit by that lack of funding. So this is what a profile page looks like. You can see prevalence and diagnoses. There's really valuable content here on PrEP, the continuum of care, and social determinants of health even for the jurisdiction. So really valuable stuff that I encourage you to dive into. And then, as I mentioned, the content from FCAA on HIV-related philanthropic funding. So we're seeing less than $500,000 in 2020 that we were able to track distributed to organizations based in Shelby County. And you'll see that breakdown by intended use and strategy, total funding for PrEP, and then just a sort of aggregate spotlight on LGBTQ communities and BIPOC communities and how much funding they received from philanthropy. So I think it's just a really valuable tool, and I want to highlight a little bit how we are hoping funders can use that, right? So diving into those profiles and understanding, specifically, areas that you're funding or you're already funding in and working in, understanding what the epidemic looks like, what that epi data looks like in that area alongside the philanthropic funding, and using that to inform your grant making. But also we want to bring this content to funders who are not necessarily funding HIV, who are not necessarily aware of the Ending the HIV Epidemic, and that might be locally or regionally focused and have an interest in these jurisdictions, and to be able to see, this is what the HIV epidemic looks like. This is how it's impacting communities that that you are funding. This is how it's impacting social determinants of health that you are funding. And this is where philanthropy is or is not responding, and have that come, in unison to really have an impact and inform grant making, and bring other funders into conversation and hopefully into funding and supporting EHE efforts. And then we want to continue to engage in this conversation. This is part of why we're having this call today, to get feedback, to hear from folks about how we can continue to support them, to bring more or different data to the table that will be useful. And I'll just close with, some of the other things we have coming down the pipeline. This is a living project, and we're trying to respond in the moment. But we also don't want to just sort of cram data down your throat, right? So we've been working with phenomenal journalist Stephen Hicks, who's been doing interviews with funders and grantees who are working in some of these jurisdictions, and trying to lift up the work that they're doing right through these narrative storytelling profiles. So we just launched one on Cook County that's up on our website. And in combination with that, we're doing a little data one-pager as well on the jurisdiction. So that will marry some of that AIDSVu epi data with FCAA's funding data. So you can again see that sort of snapshot, and then also have some stories and some examples of the work that funders are doing in partnership with grantees around EHE efforts in those jurisdictions. So we'll drop the link for that, and we hope that you continue to look at those. We have a few more coming down the pipeline soon. We want to continue to be in conversation. We do have our advocacy forum, as Mason mentioned, on April 19th in DC, where we can continue this conversation. We're excited about that. And as I mentioned, we'll continue to update this data annually as we have new content, so that we can track and see trends over time. So I'll stop there. I'm excited for the next presentation and for the conversation that we're going to have today.
Thanks so much, Kat. Every time I see this information and presentation, I have more questions. I get more excited about what's possible using some of these tools and digging in. So thank you for all this. If you have questions for Kat, please put them in the chat. We will be returning to those during the Q&A and discussion section later on. We will also be using the chat to include speaker bios, so you can read more about our wonderful speakers today. Next of which is Deasia Lee from Treatment Action Group. Deasia, turn it over to you.
Awesome. Thank you so much, Mason, and good morning, everyone, or good afternoon. I'm very happy to be here and tell you a little bit about the work that we're doing with ANIA. So ANIA is Act Now in AIDS, and I am the coalition director. So next slide, please. So just to tell you a little bit more about ANIA, we are a national coalition of community-based organizations, health departments, national partners, and activists, all committed to ending the HIV epidemic in the United States. The coalition started around 2005 with just a small network of grassroots HIV activists and advocates, all working to achieve a domestic end to the HIV epidemic here in the States. And over time, we kind of inspired like other jurisdictions to start creating EHE kind of plans and initiatives all around the country. And today, something we do is offer technical assistance to jurisdictions all over the country who are interested in starting their own EHE plans or even implementing their EHE plans. Next slide, please. And here's just a snapshot of some of our founding members. We have representation from all over the country. We host learning collaboratives to share key practices. We engage key decision makers to have Ending the Epidemic become a part of the national discourse. And we also support health departments with writing and implementing EHE plans and processes. Next slide, please. So just to tell you a little bit about a project we're working on that's relevant to this webinar, in November 2022, we sent a survey out to our coalition members to kind of evaluate successes and challenges they've had with implementing EHE plans and also mobilizing resources to communities with the most need. And the categories covered in that survey include everything from social and racial justice, community engagement, meaningful involvement of people living with HIV, and things like that. And we're still in the process of analyzing a lot of that data, but we did want to share some of the results that were relevant to this webinar today. Next slide. Yeah. So we asked organizations if financial concerns had been a primary barrier to engaging community members in prevention and treatment services specifically. And we found that overwhelmingly on the bottom axis, it says strongly agree, all the way to strongly disagree. And we found that most of our members did agree that financial concerns had been a barrier in engaging community members. Next slide. So we asked our membership whether they identified as Black, Indigenous, or a person of color. So if they were BIPOC or not. And so we saw that, you know, it still broke down that people thought that financial concerns were a huge barrier, but we saw that some of our BIPOC folk kind of felt that, you know, we have the money present. Maybe it's just not being used in the way that it needs to be used. And so we are also in the process of conducting key informant interviews to kind of follow up on some of this, to really elucidate the data that kind of came out of the survey. So next slide. So we asked some of our respondents, like, what successes has your jurisdiction had in using EHE funds to engage high impact communities? And we found that there was an opportunity for new partnerships. People were able to do more marketing campaigns. They were able to reach the priority populations that include Black and Latinx folk, MSM, trans, and cis women. We saw that there was creation of new trainings and programs, and there was more access for community members to awareness events and testing events, and more information about PEP and PrEP and mobile testing. And what also came out of that was that there was the opportunity to form new partnerships with people they had never partnered with before, like prison systems and federally qualified health centers. Next slide. We also asked, what challenges have you experienced in using EHE funds to engage high impact communities? And we saw overwhelmingly that funding in and of itself was a challenge. There were delays with getting funded allocated, receiving funding to maintain quality staff. The list of approved funding was very small, which made it very difficult to spend down the money. We saw that there were limitations of funding and having to use it within an allotted time frame. And what they were spending the funds on were activities and services that kind of had low uptake with priority populations. So they kind of had the money there, but there were difficulties with getting the money to move and getting the money to be used for things that people were actually interested in. Next slide. And so, as I mentioned earlier, we're currently in the process of doing some key informant interviews with jurisdictions that participated in the survey. And so we're kind of, as we're looking for opportunities for philanthropic organizations, something huge that really came out of the work we're doing is advocacy and training. A lot of our members are interested in advocacy and they want more training. They need more training. They don't necessarily have a staff person that's dedicated to their advocacy efforts. They're not really sure what advocacy looks like or the best way to advocate. So receiving more training and information on that. Reducing restrictions on funding for direct services. As we saw on the previous slide, there's money available, but it's kind of getting stuck. It's not being able to be used in the way that it needs to be used. So receiving funding that is a bit less restrictive about how it can be used. And looking into organizations that are HIV/AIDS adjacent or that may not have HIV or AIDS in the name of their organizations. There's a lot of housing or LGBTQ substance abuse organizations that serve the populations we're interested in. They're doing the work we're interested in, but they're not receiving funding necessarily because they don't do direct services. They may only do advocacy, but they're still working in this HIV/AIDS space, and they're still, helping us reach our goals of ending the epidemic. And then lastly, looking into rural organizations or rural serving organizations. Those are the folks who are kind of at the fringes who may need more support, need more access, and they need funding for things like internet connectivity or Wi-Fi boosters or things like that, that oftentimes can have some restrictions. So those may be some potential opportunities as well. Next slide. And lastly, I just wanted to talk about ETE University. It is our flagship technical assistance program of the coalition. And basically what we do is we help jurisdictions implement their EHE plans, and we really workshop and bring together experts and other jurisdictions who may have had success. And we kind of talk about how to work around some of the funding restrictions, how other jurisdictions have been able to accomplish some of the things they need to accomplish. And we usually bring together like local, state organizations and staff, as well as some of the health department folks are there as well. So they can hear from CBOs directly about challenges and really workshop together and come up with an action plan of how to best get the work done so that we can better end the epidemic in the US. And so I think that's my last slide. Thank you so much for having me, and I'm looking forward to the conversation.
Thank you so much, Deasia. That was great and such an important perspective for this conversation. Really appreciate the work that you all are doing. I'm going to turn it over to our next moderator. I'll take just a moment of privilege to just note that vocal and visible leadership is one of the most critical tools of philanthropy. And I am just so grateful and excited to get to partner with our next speaker and moderator, Amelia Karagi from ViV, a funder that's always willing to engage and spark conversations and talk strategy and action. So Amelia, thank you so much for moderating this next discussion. I welcome you, as well as Sarah and Athena, to come on the screen and kick off our moderated conversation.
Thanks, Mason. Hi, everybody. Welcome. So happy to be here and really grateful for the work that FCAA has done to help map where their resources are going, and the work that Deasia and the team at TAG and the Act Now End AIDS Coalition is doing to illuminate where money moves, where it needs to move differently, and what we're hearing from community-based organizations in terms of responding to some of the disparities on a local level. I'm the Director of Strategy and Programs at ViV Healthcare. I lead our community giving and engagement work. And anybody that I've talked to over the past decade has probably heard me harp on how this is a hyper-local epidemic, and that the national initiative is very helpful, but that we have to look on a local level, and we have to look in a way that disaggregates the data so that we can understand really where the disparities are for communities of color. And so I just have always relied on FCAA's data to help me understand who else is doing work on a hyper-local level, and who else could and should be doing work on a hyper-local level. And so I'm thrilled to help facilitate this conversation with my friends and colleagues, Athena and Sarah. Welcome, both shining examples of taking different approaches to philanthropy to help meet the emerging and very urgent needs in the places where you work. So welcome, everyone, and thanks for being here. So Athena, hi. It's nice to see you. I want to go to you first and hear a little bit about, given the unique, if you could introduce yourself, and then, given the unique role of AIDS United, you're a funder, you are an implementer, you are an advocacy shop. Can you talk a little bit about the ways that AIDS United is supporting the Ending the HIV Epidemic efforts around the country?
Yeah, absolutely. So hi, everyone. My name is Athena Cross. I'm the Vice President and Chief Program Officer for AIDS United. I feel very honored to be a part of this conversation. It's not often that you get to speak to a room full of funders about what's important to the organizations and communities that we support for our work. So I appreciate your time. So yeah, AIDS United, we do quite a bit in this space. One of the primary ways that we engage in our work to help end the HIV epidemic, and our work specifically on the EHE, is we are very proud to be one of the CDC's Midwest capacity building partner. And through that work, we support the Midwest EHE jurisdictions in their development and implementations implementation activities specific to strengthening the recruitment and engagement of new and non-traditional community partners. We provide culturally, linguistically, and educationally appropriate technical assistance to increase the capacity of new and existing partners to meaningfully contribute to EHE plans. And we support the mobilization and leveraging of key partnerships to maximize the reach and impact of plans. In addition to all of this, our capacity building teams work expands not only across the Midwest, but across the South as well. And through our partnerships with our advocacy team and their work to EHE specific work in our Southern HIV Fund program, which is a partnership with FCAA and some of the funders on this call, and our work with NASDAQ. On the policy side, our policy team is working with our partners at HRSA and the CDC to ensure that HIV service organizations and the broader HIV community is consulted in and engaged in the development and implementation of EHE programming in priority jurisdictions. In addition, our policy team works as part of the HIV STD partnership to facilitate increased PrEP access through CDC EHE funding, with the ultimate goal of creating a national PrEP program.
Thanks, Athena. You also happen to fund community-based organizations all across the country and in the South, many of whom receive some of their only advocacy funding from AIDS United. And they, I know, have played a really critical role in, you know, being loud locally and understanding the dynamics locally and helping to inform where the EHE work goes. And so I appreciate the work that AIDS United has done to convene funders and help pool resources and really build some of that collaboration. So as a champion of AIDS United work and your collaborative funds, I want to invite other funders who are looking for an opportunity to pool funds, support advocacy in ways that can move money to connect with AIDS United as really critical infrastructure. So thank you for the work that you do.
I'm actually here in Louisiana at the Southern HIV Fund grantee convening, and it is just amazing to be in partnership and community with all of our grantees and to really sort of hear how this funding is impactful. So thank you for those words, Amelia. It really is important as we continue to try and grow and support and expand the work that we do in the South.
And especially when you look at the FCAA data, you know, this data can be so humbling. So humbling in the way that we can, you know, in so many ways, the hyperlocal resources, anywhere from $50,000 to $2 million. I mean, that's a bulk of the advocacy resources across many states in the South. And so I think as funders, we need to keep that in perspective. I think sometimes there's a narrative that there's all this money moving around, and when you really look on a local level and you look at some of who's funding the advocacy organizations across the South, you really see how they do so much with really limited resources. So great to invite others into that conversation. So Sarah, you are one of the unicorns that's not an HIV funder, but gets it. You're sort of beyond HIV in so many ways, an intersectional funder with work that's much broader. So can you tell us a little bit about the work that you do and why your organization sees a role in the work to end the HIV epidemic in the DC area?
Absolutely. Thank you so much, Amelia. And just a little bit of background on myself and the K-Fritz Foundation. So my name's Sarah Hashful, and actually before working at the K-Fritz Foundation, I worked at AIDS United. So hello to all my AU colleagues on the line. I think I saw you, Jesse, a moment ago. It's great to be in this space with you all. Hey. So I work at the Morris and Gwendolyn K-Fritz Foundation in Washington, DC, and it's a place-based private foundation. And the mission is to improve the lives of the residents of Greater Washington. And our focus areas are really broad. It's arts and humanities, community services, education, health, and the environment. I work on the health and wellness portfolio here, which is also very broad, including HIV, but primary care to maternal health care, behavioral health, you name it. It's a very broad portfolio. And our board aims to be responsive to community needs in the area as they arise and evolve. So thinking about HIV specifically, HIV is a historical priority for the foundation, which dates back to the late 80s. And I had a fun little history project looking this up in advance of this call. So I appreciate the opportunity to learn about this history. And what I learned is at the time, our board chair felt very strongly that this was an important issue for the foundation to invest in, since it had such a large impact on the residents of our region. And he felt that while we may not be experts in HIV, and the foundation definitely was not at the time, there were others who were, and he wanted to be at the table to learn from them, to trust their lead and work together. And over the decades, we've remained involved because the epidemic has not gone away, it's evolved. The foundation started its funding more in direct services and thinking about the LGBTQ community, but efforts grew to support programs for women, people who inject drugs, communities of color. The foundation also began supporting public policy efforts focused on HIV. There's a unique political landscape here in DC with us not being a state, which is all in the news right now, but it has had a big impact on local funding for the epidemic, especially relating to use of local funds for things like syringe exchange. So the foundation really learned that it was important to support local public policy efforts to help move the needle on the epidemic. And just over the last 30 years that the foundation's been funding in this issue, there's been a lot of progress, and the foundation really remains committed to the work, especially continuing to learn and evolve as things change.
It's been really interesting to see how the epidemic in DC has changed, and K-Fritz is one of those funders who has always been there with an urgency, even when it may be because there's one person championing it. So I think that's other encouragement for folks on the line who may not be in an institution full of HIV funders, that, finding those that do understand and to help champion the issue really has made a big difference in DC when it comes to some of the harm reduction work and how that's evolved in a major way because of the advocacy funding. I think there's new harm reduction resources in DC for the first time in a decade because of some of that advocacy. So it makes a big difference. So for both of you, can you think about how this data around the funding landscape can be useful for your organization or other philanthropic or advocacy organizations? And what would you like to see FCAA do with this data? Where should it go? I'll start with you, Athena.
Yeah, I think as Katrina mentioned, one of the biggest opportunities is in identifying the gaps, right? But not just the jurisdictional gaps, like where money is going to, but in communities that are being supported through this funding. You can see when you look at the FCAA data that we've got funding for MSM, Latinx, and Black MSM, but there's a deficit in funding for programs that support Black women. And there's a deficit in funding that for programs that support youth. And I think youth actually present a really interesting challenge because in talking to young people, there's a disconnect in sort of the epidemiological needs and sort of the individual perceptions and how people sort of relate to HIV. So I think there's a really big opportunity to sort of really fund and create a next generation of HIV leaders and advocates and program managers who can be out in communities sharing these words and creating spaces for young people to be able to really engage in this issue. And I think even when we look at this data and when we use this data, what we're seeing is that there are these big, crater-sized holes in where we're supporting people, which is why we're trying to, integrate youth engagement in our, trans leadership program, in our work that we do with Black women, in our work that we do in the Latinx community and in the South, because we can't really get to our big, hairy, audacious goal of ending the HIV epidemic if we really don't start to engaging people and meeting people where they are. So I find that for us, one of the best ways that we can utilize this data is really sort of, looking at what we're missing and how we can expand our programs to really, reach more people.
Yeah, I appreciate that. What are you thinking about, Sarah?
So I think having easy to understand data is really important for people who are new to this space. And we've had a lot of talk about funders who don't fund an HIV or funding adjacent. And when you're in this space all the time, so many things feel very obvious or like baseline knowledge to you. And just as another perspective, I'm almost never in HIV spaces in my current role, and HIV is never brought up almost. And so I think that's important for me to say when I'm in this group, so you know what other funders are thinking about. Other health funders are talking about things like mental health, housing, social determinants of health is a really big thing that we're all focusing on. And there's room for us to focus on HIV there, but it's not on the radar of other funders. And so as we're thinking about bringing those funders into the fold, I think it's important to remember that the HIV space can be very intimidating for people who are new, and that's because there's so much to learn. So many people have been working in this space for their entire lifetime. It's very personal to many people. And so when you come into the space and you don't know anything about it, it can be like, oh, what am I gonna? So having that easy to understand information could be a really nice first step. I also think packaging the data in a way that draws the intersections between HIV and other focus areas is really important. So how do we bring funders that focus on housing into the fold? How do we bring youth funders into the fold? Education funders, there's always that room for that intersection. And what outreach can we be doing to those funders to get into their space, to bring HIV onto their radar? And to make those connections for us to bring them into our community. So that's what I think the data could be helpful for, especially because HIV is so intersectional. I don't need to tell anyone on this call that there's a room for every type of foundation or funder to get involved.
Yeah, and there's this interesting dynamic right now between wanting to make sure that the HIV specific infrastructure is equipped to handle some of the social determinants of health, and trying to make sure that the infrastructure that is addressing the social determinants of health has any skills and knowledge and connection to make sure that they can handle the aid service and other community-based work that is led by HIV focused organizations. So I think there's also room for funders to use this data to, make that connection between organizations in some ways, because I think funders can be making that introduction to the service providers and the advocacy organizations also. So one of the things that we sometimes see is that, this enormous amount of resources, $20 billion is what Harold mentioned, the US spends every year in terms of HIV prevention, treatment, and care. It can get bottlenecked in state health departments who are doing so much between COVID and MPOX and everything that comes to a state health department, and they're not always situated as philanthropies. Folks here know that that's a skill set, that's a set of people, that's a way of working, to be able to really resource grassroots organizations and community-based organizations. We know that, funding's being rejected by states entirely, and in some cases that's because of intense amounts of homophobia or transphobia or fill in the blank. And in other cases, it's because they lack the infrastructure to move it and they don't want to pretend that they can, right? And so what are some of the opportunities that you see for philanthropy to be responding creatively to support the federal funding getting out the door and into the hands of communities?
So I'm happy to start. So of course, there's like an increased need for public-private partnerships, right? And I think harm reduction is a really great example of that. So like in the harm reduction space, we see like increased federal funding that helps us to strengthen the capacity of SSPs. And SSPs, mind you, can be very small organizations who are, scruffy and grassroots and really just trying to make something happen in their communities. And need that sort of capacity building support to strengthen their organizations. But federal funds don't pay for syringes. And I think we all know that, like, if we are to stymie the transmission of HIV through needle exchanges, then through needle sharing, then we need to make sure that clean needles and resources are available. And that stuff is not covered by federal funds. So having that private piece of funding allows us to be able to support what's real for these organizations and what's tangible. And like at this point, it could be in-kind donations, it could be like whatever needs to happen in order to make sure that these folks on the ground have what they truly need. I mean, a high volume SSP could give out as many as 1 million syringes a year. An average size SSP is giving out close to 100,000 syringes a year, and they don't, they're not free. They don't, we need to be able to fund them. So that's really important. Another thing I think that is really important for funders to think about is how we simplify and increase opportunities for people to participate in funding. So that could be in the form of a simplified application processes and reduce low barrier applications. So some of the things that we are trying out here at AIDS United is phone applications, video applications, abbreviated application processes, and then to sort of complement that is truly understanding where community-based organizations are. And we've got organizations who are led by historically disenfranchised communities. They are often starting at a deficit, and we are expecting them to perform all the way up here, but there's like a core set of skills and resources and tools that they've never had opportunities to have or have exposure to. So it is really important when we think about capacity building resources or technical assistance resources, that we're thinking about organizational strengthening mechanisms. I'm here with 48 people from our grantees across the South, and they say things like, we need someone to help us with nonprofit finance and budgeting. We need someone to help us with people management and recruiting. We need someone to help us translate what we're doing into the words and language of this philanthropy and public health, because that, those are sort of technical skills that like a lot of folks don't actually have. So finding ways to reduce the barriers to access to funding in complement to what's happening from federal mechanisms is really important, because there's a whole bunch of people who get excluded because they don't have the tools, the skills, the resources in order to even apply, to even begin to participate.
Mm-hmm. What about you, Sarah? What do you think can happen?
Yeah, a few things. So one thing that comes to mind is highlighting again the importance of funding local advocacy to work with their local governments regarding tracking dollars and helping them get out. The other thing that I'm really thinking about is how strapped our health departments across the country are. And the COVID pandemic just made that worse, thinking about hiring freezes, lack of staff, thinking what we can do as philanthropy to help shore up our local public health infrastructure is really important. So if you have a local public health institute in your area, the Institute for Public Health Innovation here in the DC area has done really cool work supporting health departments in DC and Virginia and in Maryland. And so that's an interesting thinking about public-private partnership to help move money through. And then to Athena's point, I think, general operating support, when you can do that to help kind of fill in those gaps, whether it's to support advocacy or, whatever that organization would like to do. I feel lucky to work for an organization that's kind of almost always done general operating support. But if you still have to push for that with where you're working, I think it's really worth it to do so.
Yeah. Absolutely. I appreciate that piece around the public health institutes. I think about that a lot, is, in so many ways, we're asking the local health departments to do the same things that we may be, asking grassroots organizations to do that they're not equipped to do. So that the way that folks partner with health departments and can shore up some of those resources, I think, is important. And I think, there's an opportunity for us to look on a local level at, creating funder collaboratives and being a magnet that can help to both inform the local health departments, maybe move some of those resources locally as an intermediary, you know, to alleviate some of that pressure to try and move that money, because the pressure is so real for health departments to move that money, and it affects the whole ecosystem. So I want to open it up to the audience right now for any questions that folks may have, and I've got it open, though I don't know how good I am at facilitating with an open Q&A. I do, so I'll just give a minute here to see if anybody's got any questions or folks have responses. Go ahead. Yeah, I heard somebody's voice.
We do have a few raised hands. We have Allie has a raised hand, as well as Jeffy. So that might be a weird way to kick us off.
Let's do it. Hi, Allie. Welcome.
Hi, thank you so much for this. This is a really great panel and really informative. And you've referenced this, and I would just love your great thoughts on like how to brainstorm around this. I mean, you've referenced the problem with state health departments and being bottlenecks and not having the infrastructure, and that it's a hyper-local problem. And that was what SHIFT was designed around, like hyper-local, right? And like the communities in need, small organizations, scrappy SSPs. I think there's a challenge for national funders to fund locally at the hyper-local and grassroots level, which is where the money is needed. And there are some funder collaboratives, but it's also like, how to bring national conversations into funding streams and funding vehicles, like the pipeline issue is one question, because they're often not in a position to make a series of small grants and they lack the local knowledge, which is vital. But then I think the second thing is like how to bring more place-based and community foundations into this conversation, which is hard because obviously they're geographically distributed, and yet there needs to be a conversation with those place-based funders about how they can increase their support. I mean, I'd just love to hear your thoughts on that. Thank you.
I'll jump in with just, you've made me think like, I work for a place-based foundation, and I'm wondering like, is there an affiliation group for place-based foundations? Like, I don't know. So now I want to look into that. I think that's a really good question. And you also thinking about like how as a national funder to get the funding locally, I think that speaks to like, for example, what AIDS United does so well as an intermediary, the value of intermediaries. And then there are also other funding groups like for funders like Grantmakers in Health and these other learning spaces that could be another way, you know, if you have Grantmakers in Health, HIV doesn't often come up in those topics. And so that could be ripe for us seeing what funders are part of Grantmakers in Health or other health related, you know, foundation learning, philanthropy learning areas to see who else we can bring into the fold.
Thank you.
And I think I'll just echo what Sarah's saying. You know, being able to use an intermediary, whether it's AIDS United or some other organization, like the ability of intermediary funders to reach small organizations and provide you know, not just the funding, but also the technical resources. And I cannot stress how important it's not just giving people money, it's also giving people tools and resources. And so I think that's critically important to the discussion. But, you know, we've from a development perspective, we definitely see a contraction in the number of funders who are participating in this space. And it is, you know, and then for many reasons, folks are looking at other areas. But I think we've said many times on this call already that all of these, HIV intersects with so many things. It just does not exist by itself in a chasm. It is a part of lives. It's about how we can allow people to just live, not as people with HIV, but as human beings. So it's really important for us to, you know, try to be able to relay to folks how this all intersects. And I think FCA's data, AA's data is really sort of meaningful in helping to sow that thread. And so to the extent that there are opportunities that we could be at Grantmakers in Health and some of these other forums to talk about HIV, not in a silo, but HIV as it relates to all of these other very broad and intersecting issues is really important.
Thank you.
I would add to, you know, there's there's been, because we've been trying in a lot of different ways to figure out how to crack the local nut. I think about our work when we went to partner in Mississippi, in Jackson, Mississippi, who, if you're a Black gay man living in Jackson, Mississippi, the HIV prevalence rate is 1 in 2 already in Jackson, Mississippi, right? And so we were really trying to get more. And FCAA told us there was like one other grant happening around Jackson, Mississippi at that time. And so, what we were trying to do is get into the local, like I think in DC, it's the Washington regional area grant makers, like the local rags, and to come with a couple of national funders or local funders and community voices and people living with HIV and like get in their annual agenda, right? So if your foundation has a few geographic priorities, how do you get the issue into the agenda in front of the local funders in a way that presents the urgency and also helps, connect to the reason why you want them to engage. I also think there's this piece that I'm just going to say out loud here because it's a space where so much of the resources in America move through small family foundations. They're not large institutions. They're small, independent family foundations that usually operate hyper-locally. And there's this huge transfer of resources that happen through health conversion foundations that have to give locally. And many of them have an enormous amount of resources that they have to move every year. And they're constantly sort of looking. And I don't know that there's regularly enough connection between HIV and issues of communities of color into some of those places that are really locally focused. So I think there's some good philanthropic advocacy that we can do there to kind of unlock that. I appreciate the question. I think about it a lot. Jesse, I see your hand. Hi, welcome.
Hi, thank you. Wow, this has been really inspiring. The intersectionalities are one that we all think about, and I have some intersectional identities as chair of the board of FCAA, as president and CEO at AIDS United, and also I'm on the board of AIDSVu. So I was thrilled for that segment on the data from AIDSVu. But I'm wondering if my question is, besides funding, how can we inspire philanthropy to also use its voice, particularly in this political climate? I mean, look at what's happening in Tennessee with the Tennessee governor, but philanthropies are a respected voice for communities. And right now, the HIV community is getting swallowed up in the political discourse around race, around LGBTQ issues, around reproductive health. How can philanthropy use both its funding and its voice to help maintain and grow what's needed for ending this epidemic?
Good question. I want to invite others on the line too, not just this beautiful panel, to participate. So if folks on the line have ideas around Jesse's question about using your voice, please. I see Julie's hand. Is that a response to Jesse?
Yeah, thanks, Amelia. And Jesse, that's perfect because it's a good segue to something I was just thinking about. Everyone, I'm Julie Patterson. I'm with the AIDS Funding Collaborative in Cuyahoga County. So we're one of the EHE jurisdictions in Ohio. We actually have 3 in Ohio. And it's up on the lake, so Northeast Ohio with Cleveland. And the timing of this is so good because our advisory committee, we're a funder collaborative that's both public and private, and we've been going through strategic planning. We're trying to align our next 3-year plan with the timing of EHE, which I think is great, but it's a struggle about these same questions because we actually did a philanthropic landscape, but we also looked at the public dollars, and we're a Ryan White Part A kind of jurisdiction in our area. So we have a lot of funding coming in from that side that Harold talked about. That's the public funding. And it makes, I think, we have long-term funding partners for, almost 30 years now. And it reminds me of what Sarah was talking about. People are sometimes overwhelmed by the kind of getting inside AIDS Inc. And when they don't do that on a daily level, and it's hard because I've been doing this a long time too, and I can slip into the lingo and the all the different acronyms and bringing along folks who work more broadly in health, or maybe even a program officer and something, much more broadly. It's really this translation across. And I think one of the things we've settled on recently was this idea of using our voice as a kind of a small pool of funding compared to Ryan White, compared even to CDC funding and AHE, and leveraging our philanthropic seat at the table. So when we go to state meetings, that we can speak up, maybe we can talk to, somebody said the other day, why have I never called my state legislator on behalf of HIV-related advocacy issues? And it's like, yeah, that's a really great question. Why are we not all going to AIDS Watch as sort of philanthropy from Ohio? And I think those are some really important points, because otherwise I think we end up feeling like a small funding pool. I think we have a lot more power than that we need to recognize. So I really appreciated what you said, Jesse. I think that's really relevant for us, and in kind of finding who we are in the moment, which is shifting, right? That's what you've been talking about. It's definitely shifting. So thanks so much for this really great conversation. I appreciate it.
Thanks, Julie. Sarah or Athena, do you have any other thoughts around the philanthropic voice, or others on the line?
I do have something to share in the safe space of this conversation. It's interesting, different foundations have different levels of comfort with speaking out. And, the K-Fritz Foundation has always, from what I understand, wanted its grants to speak for themselves. And so I hear this question a lot, and about like foundations speaking out more, speaking up more, and using their power. And so internally, that's definitely something that, I'm not the decision maker here by any means, but it's something that I think about. And I know that the Washington Regional Association of Grantmakers is also thinking about how to mobilize its members, and we're all place-based funders here in the DC area. And I know they're trying to get foundations to move in that direction as well. So I think it's a great point, and I do think it's an underutilized tool by philanthropy who shy away from it. So yeah, Jesse, great point.
I wonder if there's a way to tap into some of the board members in philanthropy in a different way, and use it as kind of a board development opportunity, or to really find, the voices within the institution, I think, and the different circles that they inhabit in a different way. Yeah, I think it's an important piece of the puzzle. I'm gonna see if there's any questions before we close us out. Thank you for this rich discussion. And thank you for everybody who's joined us on the line, who I know is all trying to help move the resources where the need is the greatest in a way that makes a difference. And so encourage us all to stay connected and stay in touch, and appreciate you, Sarah and Athena, and the conversation today, and Deasia, and the wonderful work that is happening with the ANIA Coalition and FCAA's wonderful data. So thanks for bringing us together. I'll turn it over to you, Mason, to close us out.
Thank you all so much, to all the speakers and all of you on today. I know I'm full of ideas now. I want to create a Rosetta Stone to help translate HIV language and framing for non-HIV focused donors. I kind of love some of these discussions. So as Kat mentioned earlier, we really want to encourage you to continue to check out FCAA's continuing work on the HE. This is a big, important initiative, and we want to make sure that we are helpful. So check out our jurisdiction-specific data, the narrative features coming out. We recently published a set on Cook County, Illinois, and before the end of the month, we'll have one on DC. Please, let's keep telling these stories and helping people realize the real people and needs behind these numbers. Finally, I hope you will come and join us in DC next month. I know advocacy is not always the easiest thing for foundations to think about, but there's so many things that we can do together. without having some sort of direct lobbying. And there's a moment that we're in right now, and I think Jesse referenced it, where we are at a turning point. We have communities under attack, especially those impacted by HIV the most, especially in certain parts of our country. And it's time for us to come and make sure we all understand what's going on, what's at stake, and what we can do, and what our grantees can do. So please join us for the advocacy forum that we're having. We've got a great set of speakers, including Harold Phillips. And we're going to be online for those who can't make it, but there's nothing like being there in person, and you can have a really amazing lunch and dessert reception, and we can all like plan the improvement of the world together in person. So April 19th, DC. Thank you all so much for being a part of this. We will be in touch soon. Let's keep the conversation going, and thanks for all the work that you do. Have a great rest of your day.
Thank you.
Bye.
Bye.
Take good care. Be well.